It is the one measure that seems to worry health experts the most when it comes to the pandemic. The number of people sick enough with coronavirus that they need hospital care. On Sunday, the nation passed another record high, more than 93,000 hospitalizations. That's the highest number since the start of the pandemic. And the Midwest is feeling the brunt of it. On Sunday, the 7-day average of hospitalizations in the St. Louis, Missouri region reached a new high as well for the third straight day. More than 900 patients in the hospital with COVID-related illnesses. Current models predict that the region's hospital system could run out of intensive care beds this week. Let's get a view from the ground there right now. Joining me right now is Dr. Alex Garza. He's the Chief Community Health Officer for the SSM Health Hospital Group in St. Louis and also serves as the head of the area's pandemic task force. Dr. Garza, thank you for being here. What is the status of where you are? How strained are things getting in your hospitals?
Yeah, they're very strained. So I spent last Wednesday and Friday at one of our hospitals, and of course we had no ICU bed capacity on each of those days. We had to fly patients in critical care outside of the St. Louis metropolitan area to hospitals in the outlying areas because we simply didn't have any critical care capacity within the St. Louis metropolitan area. And that's a pretty scary thing when you're thinking about how do we take care of these patients going forward with limited capacity.
Doctor, it's a terrifying thing. And in the patients that you're in critical care that you're having to fly out, what are those patients suffering from? These are these patients that are coming in with non-COVID related emergencies, I assume.
Correct. It could be anything from a COVID-related emergency to any of the other medical emergencies that we handle, whether it's heart attacks or strokes or any of a number of other things. I think what else people don't realize is the COVID statistics that we put out saying this is the number of COVID patients we're taking care of doesn't also include the patients that come back from complications from COVID. And so it has this ripple effect downstream that really complicates how we can take care of all of the patients that are going to need care at our hospitals.
I think this is a message that people really do need to understand when they often see these numbers or hear these numbers that we report and you put out as well, and they need to understand that it's not someone else that's being hospitalized. When a hospital has filled up, you can't get care if you are in an emergency at your nearest hospital, potentially. You're just telling us you're having to send patients who are in critical need of care, who otherwise you would never turn away from your hospital, and you're having to send them away. How far away are you having to send them?
Yeah, so that is an important message. We'll always take care of everybody, but the timeliness and whenever you're distracting people with such a huge volume of patients, you're never going to get as good of care as you deserve. And so from the last couple of days that I was at this hospital, we were flying patients to Quincy, Illinois, and up to Hannibal, Missouri, which seems really bizarre that you would send patients from a major metropolitan area in the United States into an outlying area. But that is where we could find the critical care bed. There was absolutely no critical care beds in St. Louis.
The Mayo Clinic in Minnesota has said that they, just as one example, has said that they've started bringing in staff, nurses and other hospital staff because of just to help backstop staffing shortages from Arizona and even Florida. Are you having to do the same?
So, yes, although it's a bit of a different tack. So we're doing the best that we can to bring in contract nursing, which I think most of the systems are in the same boat. So trying to get nurses that are on contract to come in from out of town to staff some of our needs. Now, we're just staying afloat, I would say, by getting all of this contract nursing into place. So it's not that we're able to scale up for any surge in patients. This is really just keeping up with the volume that we have right now. And the thing to note about that is, I'm sorry, but it's super expensive to bring those nurses in.
Yeah, and I was just going to say, if it doesn't get better, if it doesn't let up, I mean, you're seeing this, and we haven't even seen what comes after Thanksgiving. What is it going to mean for the system where you are?
Well, we're going to try and create capacity wherever we can. So whether that is down-ramping other services that we provide, whether that is increasing our nurse-to-patient ratios, or whether that is being, doing different levels of care. So we will create capacity as much as we can. But what I tell everybody is that healthcare is a finite resource. We just can't create critical care nurses overnight. And at some point, we will be at our capacity. We'll keep managing, but it is extremely difficult.
Yeah, but things will suffer. Not by your doing, but things will suffer because of it. The system cannot bear the brunt of this pressure over and over again. Dr. Garza, thank you for your time.
Anytime. Thank you.
Coming up for us.